right now I'm going to pass it to Julia and Todd to kind of share the updates that the NHC has, and then also some new, I guess your podcast and different pages that are on the website as well.
Thank you. Can everybody see my page, the National HIV Curriculum?
Yes, we can see it.
Excellent. So first of all, thank you all for inviting us on for updates. We have a lot to share, so we're going to move quickly through it, but it was so cool to see all the data. It's always like, yay, we're making that impact. So just to move quickly through, I want to start with just some stats. We have 85,000 registered learners on this curriculum, and more than 2,000 groups have been created. And as you know, we are continually updating content, including recently, there's been new vaccine guidelines around COVID, around flu. There's new guidelines for cervical and anal cancer and use of statins. So all of that content has been updated on our sites. And a lot of times where you will see a dive into new content is if you use our search function. And we just recently updated our search function to capture podcast episodes and mini lectures. So I'm going to switch over and kind of jump into looking at podcasts. So we launched our podcast series in March of this year. We have had 17 episodes, and we just reached a milestone of 5,000 downloads. And this is a very, we try to target it for, new providers, but it's also going to be of interest to longtime people who work with people with HIV. But this is the focus: practice changing issues and updates in HIV diagnosis, management, and prevention. Our podcast editors are our 3 associate editors for the curriculum, and they work very closely with Dr. David Spock, our PI, for reviewing and approving. And then all of our podcast episodes are reviewed by HRSA as well. And so you can access these podcast episodes through your podcast app. And then also we have a playlist on YouTube. So if you want to access it through that. And as you can see, you can filter by categories and also by topics. And our most popular episode so far, interestingly, was our very first one, which was antiretroviral therapy, or ART, which is what I'll continue to use, and weight gain. And but future episodes are going to include the 3 of the editors talking about how to initiate ART and how they do it in their clinic. And then another episode will be about switching ARTs. And then I don't know if you've had a chance to listen, but Dr. Budak and Dr. Kalopila do this really interesting case discussion thing where they kind of walk through, how do you diagnose? How do you treat a specific opportunistic infection? So when we'll continue, we shoot to have 2 episodes a month, but things happen. They can be very complicated to put on at times. Mini lectures, I don't know if you all subscribe already to our mini lectures, but these are the 4 most recent mini lecture topics that we have released. And so you can always find that recently added. But then we also have, this category here: HIV biology and mechanism of action, lenacapavir, which is just recently approved by FDA. We just did a big, Dr. Spock did a mechanism of action on that one. Guideline updates, antiretroviral medications, and co-infections. And the most popular mini lecture is this HIV life cycle, because it's such a great introduction to people who really don't have any familiarity with HIV. And it's Dr. David Spock, an award-winning educator, and just some really cool graphics. But I encourage you to check that out on your own if you haven't already. And just to give you a sneak preview on some other upcoming mini lectures, is one will be Dr. David Spock is going to do an HIV ART fundamentals mini lecture, which will target non-prescribers and people who are new to HIV. And also we will start doing an annual mini lecture on kind of reviewing what's happened in the field of ART every year. But then we'll also still do mini lectures within these different categories, including like CROI updates and all of that. And then just, I saw there was a couple of dentists on, and give you a heads up, we are working with the AETC regional dental directors about doing kind of more of a streamlined oral health pathway, which we should release in the early part of next year. I'm going to turn it over to Todd to talk about non-clinical updates to the National HIV Curriculum. I'll stop sharing.
Thank you, Julia. And can everybody see that?
Yes.
Great. Okay, so I just wanted to talk quickly about this about section on the website, which can be accessed from any page down in the lower right corner. You'll see links that say about and privacy policy. Click on any of those. It'll bring you to this section of the site. We did add this recently, this site overview video to the About page. It's about 7 minutes long, and it really goes through how to navigate this site, how to use self-study, all of the features on the site as well. So that's a great resource. And there's also, all the information about the site and the program here as well. We've also recently added this frequently asked questions section, and we've divided the questions up into different categories, and including screenshots and instructions as well. And from each of these sections, there's always a link to go back up to the top. So that is a great resource for commonly asked questions. And then we also have this recently added this learning groups page, which also has a learning groups video. It's about, again, 7 minutes long, covering how to create a group, how to invite learners and managers and evaluators, and how to monitor group progress. And it also shows some perspective from the learner's point of view. We've got this benefits of forming a group section down here as well. And we also recently created some downloadable learning group guides. And I know that Take has created some fabulous guides for all of you, but we also just wanted to let you know that we have this as a resource here as well. And I'll turn it back to Julia.
Thank you, Todd. So I'm going to share my screen again, and hopefully you all see the National STD Curriculum now. I wanted to give you all a heads up that there's some changes have been happening on this site. This is our most popular site with 111,000 registered learners. And as you can see, we are currently in 2nd edition, and we will be launching 3rd edition on April 1st. So that means if people can earn, just like HIV, National HIV Curriculum, you can earn CE on both editions because the newest edition will be completely updated. But we haven't waited. We've added recent content, including a Mycoplasma genitalium and an Mpox lesson. We've added question banks even after that around Mpox, PID, and some other topics. And then I also wanted to highlight, I don't know if you all are aware, but in April of this year, we launched this lecture series, which is really more for people who are very new to the National STD Curriculum or to STDs and STIs. And so what we did is we did a lecture, a mini lecture, actually longer than a lecture, mini lecture, because they're around a half hour to an hour. And we got our National STD Prevention Training Center's faculty to prepare presentations on the 9 most prevalent STIs. And then they cover these 8 key topics. So again, this might be a great intro for people who don't want to read a lesson, they'd rather watch a video. And then the National STD podcast is still moving right along. That we've started our 4th season in a couple months ago, and we are coming on to 50,000 downloads. And This focuses on innovative and significant STD issues and discusses the clinical implications. You can, download and follow. And as you can see, there are just a wide variety of STDs that are covered. And outside of STD issues, like things like how to take a sexual history. And these are just really informative episodes. But we also have had many episodes on the implementation and around DoxyPEP. And you all are probably the first to know because we just launched this DoxyPEP guide. We haven't done that. We're going to start promoting it next week, but we always kind of don't promote right away. We kind of, check and make sure it works everything works okay. We get feedback. And so we just launched this about a week or two ago. And this is supporting the June 2024 CDC release of new guidelines about how to use doxycycline as a post-exposure prophylaxis for STI prevention. So this is really a lot of healthcare providers don't really understand how to use DoxyPEP. And so this goes into details around counseling, the research studies that help form the guidelines. But also what's really important, there's 4 pages or 14 questions for healthcare professionals about the most common questions. And then there's the Mpox clinical guide that we released last year. And so as you know, they're looking at Mpox as being kind of a continual, process of coming through and around. So anyway, these clinical guides you can download, you can view them, or you can share them. And then finally, I just want to touch base on the Hepatitis C Online. So Hepatitis C Online is our oldest curricula, and we just finished launching our 4th edition in May. But I wanted so there's 31 lessons over these 6 modules. But I wanted to give you all a heads up that in January or so, we're going to be launching an entirely new module that is specifically targeting primary care providers about the direct acting antiviral therapy, which can cure hepatitis C. And you don't have to go through a hepatologist, et cetera. And so this will be a self-contained module. People can take an assessment, they can earn a training certificate, and then this will be a big step to help prevent HCV, cure it and prevent it. So that's the overview. Suyana, I'm sorry I didn't check our time if there's time for questions, but we're always available by email.